BCEN test prep exam based. Question 1. A female patient of childbearing age with abdominal pain should always be evaluated for Option A. Ovarian cysts. Option B. Pregnancy status. Option C. Endometriosis. Option D. PID. The correct answer is option B. Pregnancy status. Question 2. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mmHg and in the left arm is 130/80 mmHg. The chest X-ray shows a whitened mediastinum. The nurse suspects Option A. Acute myocardial infarction. Option B. Thoracic aortic dissection. Option C. Pulmonary embolism. Option D. Tension pneumothorax. The correct answer is option B. Thoracic aortic dissection. Question 3. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates Option A. A damage above the midbrain. Option B. A damage at or below the midbrain/brainstem. Option C. Damage to the cerebral cortex. Option D. A positive outcome. The correct answer is option B. Damage at or below the midbrain/brainstem. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Which of the following is an early, compensatory sign of shock? Option A. Anuria. Option B. Metabolic acidosis. Option C. Tachycardia. Option D. Unconsciousness. The correct answer is option C. Tachycardia. Question 5. The purpose of administering surfactant to a patient with ARDS is to Option A. Bronchodilate the airways. Option B. Reduce alveolar surface tension and prevent atelectasis. Option C. Decrease pulmonary capillary permeability. Option D. Increase mucociliary clearance. The correct answer is option B. Reduce alveolar surface tension and prevent atelectasis. Question 6. The priority patient for a trauma team activation based on mechanism of injury is Option A. An adult who fell from standing height. Option B. A pedestrian struck by a car traveling 15 miles per hour. Option C. An adult ejected from a vehicle. Option D. An adult with a gunshot wound to the forearm. The correct answer is option C. An adult ejected from a vehicle. Question 7. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents Option A. Uncompensated respiratory acidosis. Option B. Compensated respiratory acidosis. Option C. Uncompensated metabolic acidosis. Option D. Compensated metabolic acidosis. The correct answer is option A. Uncompensated respiratory acidosis. Question 8. The emergency nurse suspects acute epiglottitis in a patient presenting with Option A. Inspiratory stridor, drooling, and tripod positioning. Option B. Barking cough, low-grade fever, and hoarseness. Option C. Productive cough, pleuritic chest pain, and fever. Option D. A wheezing, prolonged expiration, and accessory muscle use. The correct answer is option A. Inspiratory stridor, drooling, and tripod positioning. Are you looking for BCEN exam actual questions? Visit our website pokerexams.com to access BCEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get BCEN exam answer key today. Question 9. A patient receiving intravenous nitroglycerin for chest pain develops severe headache. The nurse should Option A. Stop the nitroglycerin infusion immediately. Option B. Administer morphine for the headache. Option C. Treat the headache and continue nitroglycerin as ordered. Option D. Switch to oral nitrates. The correct answer is option C. Treat the headache and continue nitroglycerin as ordered. Question 10. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects Option A. Open-angle glaucoma. Option B. Acute angle-closure glaucoma. Option C, a conjunctivitis. Option D, uveitis. The correct answer is option B, acute angle minus closure glaucoma. Question 11. Which assessment finding is consistent with a flail chest? Option A, a crepitus over the sternum. Option B, paradoxical chest wall movement. Option C, a tracheal deviation. Option D, subcutaneous emphysema. The correct answer is option B, paradoxical chest wall movement. Question 12. The hallmark sign of compartment syndrome is: Option A, pain relieved by elevation. Option B, pain out of proportion to the injury. Option C, absent pulse in the affected extremity. Option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Question 13. A patient presents with sudden onset worst headache of my life. The nurse's first priority is: Option A, administer pain medication. Option B, perform a complete neurological assessment. Option C, prepare for lumbar puncture. Option D, obtain a non-contrast CT scan of the head. The correct answer is option D, obtain a non-contrast CT scan of the head. Question 14. A patient presents with a chemical eye splash. What is the priority nursing intervention? Option A, patch both eyes. Option B, immediate copious irrigation with water or normal saline. Option C, administer topical antibiotic drops. Option D, perform a visual acuity test. The correct answer is option B, immediate copious irrigation with water or normal saline. Question 15. The safe harbor provision for nurses typically refers to: Option A, a law that provides legal immunity in all circumstances. Option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C, a hospital policy allowing nurses to refuse any assignment. Option D, the requirement to report all medication errors. The correct answer is option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Question 16. The best method to remove a prosthetic eye in an emergency is: Option A, using forceps to grasp the prosthetic. Option B, applying suction with a bulb syringe. Option C, using a suction cup designed for prosthesis removal. Option D, sweeping a finger around the edge to break the suction. The correct answer is option C, using a suction cup designed for prosthesis removal. Question 17. A patient presents with cramping abdominal pain, distension, vomiting, and high-pitched tinkling bowel sounds. These findings are most consistent with: Option A, gastroenteritis. Option B, bowel obstruction. Option C, irritable bowel syndrome. Option D, acute pancreatitis. The correct answer is option B, bowel obstruction. Question 18. When receiving a verbal or telephone order in an emergency, the nurse should: Option A, carry out the order immediately without verification. Option B, write it down and read it back to the provider for verification. Option C, ask another nurse to take the order. Option D, refuse to take verbal orders. The correct answer is option B, write it down and read it back to the provider for verification. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes: Option A, hypertension, bradycardia, headache. Option B, abdominal pain, hypotension, and a pulsatile mass. Option C, fever, chills, flank pain. Option D, dysuria, frequency, urgency. The correct answer is option B, abdominal pain, hypotension, and a pulsatile mass. Question 20. Which laboratory value is most indicative of acute kidney injury? Option A, elevated white blood cell count. Option B, elevated creatinine and BUN. Option C, decreased platelet count. Option D, elevated liver enzymes. The correct answer is option B, elevated creatinine and BUN. Question 21. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A, abdominal X-ray. Option B, abdominal ultrasound. Option C, CT scan of the abdomen. Option D, a complete blood count. The correct answer is option C, CT scan of the abdomen. Question 22. Necrotizing fasciitis requires what priority treatment? Option A, broad spectrum antibiotics alone. Option B, immediate surgical debridement. Option C, hyperbaric oxygen therapy. Option D, wound vac placement. The correct answer is option B, immediate surgical debridement. Question 23. In a multiple casualty incident, the triage tag for a patient with breathing 30/min, no radial pulse, and who does not follow commands is option A, green, minor. Option B, yellow, delayed. Option C, red, immediate. Option D, black, deceased/expectant. The correct answer is option C, red, immediate. Question 24. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects option A, cystitis. Option B, pyelonephritis. Option C, nephrolithiasis. Option D, renal artery stenosis. The correct answer is option B, pyelonephritis. Question 25. The most common cause of lower gastrointestinal bleeding in adults is option A, gastric ulcer. Option B, diverticulosis. Option C, esophageal varices. Option D, Mallory-Weiss-Tear. The correct answer is option B, diverticulosis.